Welcome to our demonstration of the Kimberly-Clark Kimvent multi-access port closed suction system and the Kimvent Balcath bronchial aspirate sampling catheter. The demonstration you are about to see applies to the following family of products: Kimvent multi-access port closed suction catheter, Kimvent multi-access port closed suction system wet pack, Kimvent multi-access port closed suction replacement catheter, and the Kimvent Balcath bronchial aspirate sampling catheter. Currently, in order to perform additional procedures on ventilated patients, such as bronchoalveolar lavage, bronchoscopy, or drug delivery, clinicians have had to break the ventilator circuit, exposing the patient to contamination from outside pathogens, a leading cause of ventilator-associated pneumonia. This also can expose the caregiver to pathogens from the patient. But with Kimvent multi-access port closed suction system, the compact rotating manifold provides multiple ports to access the patient's airway, locking into place with a click. This reassures that the circuit remains sealed, enabling catheter replacement without opening the circuit. The single-use seal cassette maintains Peep during insertion of a sampling catheter or other devices, so both suctioning and alternate procedures can be performed while maintaining a closed vent circuit. Before setting up the procedure, wash your hands according to your unit protocol. To set up the procedure, first select the appropriate size Kimvent MAP closed suction catheter. To calculate the correct size catheter, multiply the endotracheal tube diameter by 2. In this case, 6 millimeters times 2 equals 12. Then use the next smallest size catheter, which in this case would be a 10 French. The size of the catheter can be found in the catheter size selection zone located on the upper right-hand corner of the Kimvent multi-access port closed suction system packaging label. Furthermore, the size is indicated by color. Specifically, each corresponds to the French size and is in compliance with the international standard. Next, attach the thumb control valve to the suction tubing. Depress and hold the thumb valve and simultaneously adjust the vacuum regulator to the desired level. Then release the thumb control valve and attach the Kimvent MAP closed suction catheter between the patient and the ventilator circuit. Stabilize the catheter in the artificial airway with one hand. Ensure that the catheter is in line with the artificial airway. Depress the plunger button and rotate the Kimvent MAP closed suction manifold if necessary. Be sure that the black marking ring is visible inside the sleeve. Open the cap on the irrigation port. Insert the saline vial into the irrigation port. Advance the catheter to the desired depth in the artificial airway using your thumb and forefinger of your opposite hand. Depress and hold the thumb control valve, then gently withdraw the catheter. The tethered sleeve, which provides a stop when retracting the catheter, therefore prevents over-retraction that leads to the inflation of the sleeve. Stop withdrawal when the black marking ring is visible inside the sleeve. Release the thumb control valve and repeat the previous steps as necessary. Lock the thumb control valve when not suctioning to prevent inadvertent or accidental activation. The lock graphic provides a clear indication that the suctioning thumb valve cannot be depressed. Intermittently depress and release the thumb valve until the catheter and chamber are clear or until the vial is empty. Lock the thumb control valve when not suctioning to prevent inadvertent or accidental activation. Align any printed depth number on the catheter with the similar number printed on the endotracheal tube. In this case, 30 centimeters on the catheter will line up with 30 centimeters on the endotracheal tube. Or, observe the printed number on the endotracheal tube closest to the endotracheal tube adapter. Add 6 centimeters. In this case, 30 centimeters on the endotracheal tube plus 6 centimeters equals 36 centimeters. Advance the catheter until the sum appears in the window of the Kimvent MAP closed suction manifold. The catheter tip will be within 1 centimeter of the end of the artificial airway. Next, we will demonstrate the use of the alternate therapy port using the Kimvent Valcath Bronchial Aspirate Sampling Catheter, which is designed to be compatible with the Kimvent multi-access port closed suction systems, enabling clinicians to quickly and safely obtain a lower respiratory tract sample on mechanically ventilated patients without opening the ventilator circuit. Remember to use a sterile technique when performing the procedure. Before setting up the procedure, wash your hands according to your unit protocol. It's also recommended that you wear protective measures such as gowns, face masks, and gloves. To use the Kimvent Valcath Bronchial Aspirate Sampling Catheter, depress the plunger button and rotate the Kimvent MAP closed suction manifold so the alternate therapy port is in line with the airway. Attach the sterile suction tubing to the sputum trap with suction tubing to wall suction. Attach the sputum trap. Attach the suction adapter to the three-way stopcock on the inner catheter. Attach the suction tubing to the suction adapter. Close the stopcock to suction. Attach the syringe to other port on three-way stopcock. After removing the Valcath from the package, remove the protective clip from tip of the Valcath catheter. Open the cap of the seal cassette on the Kimvent MAP. Remove the Valcath adapter from the package and attach to the seal cassette. The seal cassette aids in the maintenance of Peep throughout the procedure. Insert the Valcath through the Valcath adapter into the seal cassette, keeping the tip sterile. Position the curve of the directional tip catheter for right or left lung sampling and continue advancing. If the tip angles towards the Y of the manifold, then rotate the tip up until you are clear of the manifold. Rotate back to the desired lung and continue to advance. Use the oxygen port as your reference point. The curve in the port should be on the same side. The directional catheter allows the clinician to steer the catheter into the right or the left lung. Align the numbers on the ET tube with the numbers on the bowel catheter. We align those numbers to provide reference when the Valcath is at the end of the ET tube. In this case, 30 centimeters on the ET tube should line up with 30 centimeters on the bowel catheter. Advance the Valcath another 5 centimeters beyond the end of the ET or trach tube. Clear the tip by flushing with 2 millimeters of saline. The intent of this step is to clear the tip of any contaminants as it moves through the upper airway. Hold the outer sheath in place and advance the inner catheter until resistance is met. The inner catheter should now be in a wedge position. Lock outer sheath in position by sliding the blue slide lock. Perform bowel according to protocol. The Valcath procedure allows the clinician the flexibility to suction via the wall suction or with a syringe. Instill the desired amount of saline and suction by rotating the stopcock. Repeat until the total volume of bowel fluid has been infused and an adequate sample volume has been obtained. After obtaining the sample, open the blue slide lock and pull the inner catheter back until the black strip is visible behind the control hub seal. Remove the Valcath completely. Depress the plunger button and rotate the Kimvent multi-access port closed suction catheter to the off or suction position. Remove the seal cassette by rotating it counterclockwise. Replace with a new seal cassette found in the Valcath package or as a separately sold accessory after each use or instrument insertion. Kimvent multi-access port closed suction catheter can be rotated from suction to off or to alternate therapy positions by depressing the plunger button and rotating the manifold. Key points of differentiation include soft cushion tip designed to be atraumatic to the patient, telescoping catheter where the inner catheter is protected by the outer catheter to minimize upper airway contamination, directional catheter for right or left lung sampling, seal cassette to maintain Peep throughout the procedure. The thumb control valve can be locked to prevent inadvertent or accidental activation. To lock, lift the white part of the thumb control valve and rotate 180 degrees. A closed lock image indicates a closed position. To unlock, repeat this action. An open lock image indicates an open position. Stabilize the artificial airway with one hand. Ensure the Kimvent MAP closed suction manifold is rotated to the alternate therapy or off position with seal cassette. Detach by rotating the replacement catheter counterclockwise. Replace with a new replacement catheter by inserting the catheter and rotating clockwise until a snug fit is reached. Then return the catheter back to the desired position. Use of Kimvent MAP closed suction replacement catheter is not recommended for more than 72 hours. Apply the appropriate day sticker to the thumb control valve. As an example, if the Kimvent MAP closed suction catheter is opened on Tuesday, place the Friday sticker on the thumb control valve of the replacement catheter. Kimvent Multi-Access Port Closed Suction System Wet Pack provides saline vials for cleaning the catheter tip. Remove the vial from the pack and twist the top to remove. Insert a saline vial into the irrigation port. Intermittently depress and release the thumb valve until the catheter and chamber are clear or until vial is empty. Discard properly after use. As we have demonstrated, the Kimvent Multi-Access Port Closed Suction System is designed to be compatible with both the Kimvent Valcath Bronchial Aspirate Sampling Catheter or a bronchoscope. Clinicians can now safely and quickly obtain a lower respiratory tract sample that provides an accurate lung infection diagnosis for targeted antibiotic treatment without opening the ventilator circuit. The Kimvent solution, the multi-access port, and Valcath allow clinicians to clear and diagnose the patient's airway.